Bismillahirrahmanirrahim. Assalamu alaikum. I welcome all the audience from all around the world to today's webinar organized by Imamia Medics International Academic Council. First of all, I would like to introduce myself. My name is Samreen Fatma and I am associated with IMI International Academic Council as Academic Coordinator. Today, I have my co-host, Dr. Kiran Ijaz, in this session. She is from US and has been associated with IMI International Academic Council for past 7 years. Welcome, Dr. Kiran.
Assalamu alaikum, everyone.
Walaikum assalam. It has been a tradition of IMI International Academic Council to hold sessions every year for managing health during the month of Ramadan. In continuation of the series, today we have highly qualified clinical professionals here to discuss on the topic of diabetes and Ramadan, a balanced approach. This session will also include clinical recommendations for patients with comorbid diseases and for those women who are pregnant and are willing to fast. So we will begin the session with the name of Almighty Allah. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم شهر رمضان الذي أنزل فيه القرآن هدى للناس وبينات من الهدى والفرقان فمن شهد منكم الشهر فليصمه ومن كان مريضا أو على سفر فعدة من أيام أخر يريد الله بكم اليسر ولا يريد بكم العسر ولتكملوا العدة ولتكبروا الله على ما هداكم ولعلكم تشكرون Sadaqallahul Aliyul Azim. Surah Baqarah, verse 185, chapter 2. Now I would like to introduce our first speaker, Dr. Muhammad Ishaq Arstu, who is an associate professor at Keck School of Medicine, Temple University. He is a practicing endocrinologist in Bethlehem, Pennsylvania, associated with St. Luke's University Hospital for around 40 years. Welcome, Dr. Arstu. Over to you.
Thank you. Assalamu alaikum, everybody. Can you hear me clearly?
Yes.
Wa alaikum salam.
I think diabetes as a disease is a very ancient disease where people have known about it probably quite a long time. But it is currently getting higher and higher in incidence because of the growth of the population and the growth of nutritional availability. So obesity has become a part of the diabetes syndrome. We can actually call it diabesity because of the coexistence of obesity and diabetes. I will start with the translation. The month of Ramzan, in which was revealed the Quran, a guidance to the people and a clear proof of guidance and criterion. So whosoever sights the new moon, the month, let him fast it. And whosoever is ill or on a journey, then an equal number of other days. Allah intends you ease and does not intend you for hardship and for you to complete the period and to glorify Allah for which He has guided you, and perhaps you will be grateful. It's the translation of the Surah Baqarah, Ayat 2, 185. Bismillahir Rahmanir Rahim. As you can see from this beautiful, colorful slide, how the prevalence of diabetes is currently 463 million people worldwide have been diagnosed as a diabetic. And it's like an iceberg. So many other people have what is called pre-diabetes before they become clinically identified as a diabetic. And because high glucose levels is associated with glucose toxicity or damage created by glucose in excess to the circulatory system and other parts of the body, complications can become a very important difficulty with the care of diabetes. Diabetes can involve the eyes, the kidney, the big and the small blood vessels of the body. Unfortunately, it also affects the minorities much more than the general population. Particularly, it is exploding in countries like Middle East, Asia, and in Africa. Uh, the Muslim population, by the grace of God, is also slowly, progressively increasing. And the diaspora of the Muslim population across Europe has created some very interesting situations. For instance, the people who had migrated from the south of India into South Africa, their incidence of diabetes have just skyrocketed. Uh, uh, 1 in 3 could be considered diabetics, probably because of the change of environment, change of lifestyle, and also nutritional status. There are major types of diabetes according to the American Diabetes Association and other people, other organizations. The World Health Organization has created a classification called type 1 diabetes and type 2 diabetes. The type 1 diabetes is usually because of there is a damage to the beta cells, the cells that produce insulin from the pancreas. There's a deficiency of insulin and there's an excess of glucagon, the other hormone. So it usually involves young people and is only about 10% of the population. Uh, Type 1 diabetes also has a distribution curve. If you look at Europe, for instance, in Finland and in northern borders of Europe, there is a very high incidence compared to the southern border, except in an island called Sardinia, where there's an exceptionally high incidence of type 1 diabetes. Type 1 diabetes is called an autoimmune disorder, where there is a damage to the beta cells by an antibody against the type 1 diabetic. Type 1 diabetes is a diabetes in which you really cannot can we go back to the slide? In type 1 diabetes, you require insulin, and insulin can be delivered by various methods, but it cannot be given by mouth because it's a peptide hormone. It has to be injected. Insulin was first discovered in, say, 1921 by Banting and Best, and has been now been available for all populations of the world. Insulin can be delivered through an injection 3 or 4 times a day for type 1 diabetics, or it can be delivered through an insulin pump. Type 1 diabetes has seen a lot of advances, and hopefully there may be a cure to stop the autoimmune process down the road. Anyway, the inheritance of type 1 diabetes is very different from the inheritance of type 2 diabetes. If the father of a type 1 diabetic there is a high probability of that being seen in the children as compared to the mother being a type 1 diabetic. In the past, type 1 diabetics would not live more than 40, 50 years of their life, but with the discovery of insulin, uh, none of the type 1 diabetics have died in terms of onset. You can stop the progressive disease. Without insulin, the children usually who develop type 1 diabetes do not survive more than a few months at the best. Type 1 diabetes can be also uh, treated with constant monitoring of glucose, called continuous glucose monitoring, and can be by finger stick method. So, with the availability of the insulin pumps, insulin delivery systems, different types of insulins, and the type 1 diabetics have been living longer and longer. And the complication of diabetic retinopathy with the eye disease, neuropathy, nerve disease, and nephropathy has also become much less. I'm seeing type 1 diabetics live 60, 70, 80 years. My oldest type 1 diabetic is about 94 years old. Uh, Type 2 diabetes is a different story altogether. In fact, many of us will develop type 2 diabetes or pre-diabetes. Diabetes as generally has been described as a condition in which the blood glucose or the blood sugar is greater than 126. If the sugar is between 100 and 125, one could call that pre-diabetes. Even with the blood sugar of 99, which is considered normal, uh, you can see that there is a general mild drift that occurs with age. Younger people will have a blood sugar in the 70s and 80s, and people in their 30s will have blood sugars in the 80s and 90s. Usually, older people will have 90s to 110. But even in the drift, if that drift has occurred earlier, like a younger person has a blood sugar fasting of 94, one might be alerted to consider doing some lifestyle intervention to avoid progression into a rapid course of hyperglycemia or increased blood sugar. Sugar is an important element for our body because it is need to generate substances that reduce energy in our body. But too much sugar is very dangerous because the body cannot handle more than 180 milligrams. So that is called renal threshold. Uh, so we try to keep the blood sugars in diabetics between 100 and 150 in a general way. And we can measure that by measuring fingerstick blood sugars, or we can even measure it by doing what is called a hemoglobin A1C. Hemoglobin A1C is a marker that reflects the blood sugar for the past 120 days. With an exception of a few conditions where hemoglobin A1C is not useful because of the glycosylation process may not be properly understood. Most of the time, hemoglobin A1C is also used in the follow-up of diabetic patients. When we fast, what happens is that our body tries to keep up the glucose level so that the brain can constantly use the glucose. And that is by mobilizing reserves in the liver called glycogen. It's broken down. But as we fast longer and longer, then glycogen is depleted and there is no glycogen, then fats become the next source. When there is uh, a prolongation of the fast, then we start breaking fats and we generate substances called ketone bodies. You might have heard of the word uh, ketogenic diets and so forth. In the complications of diabetes, there are two major complications that limits our treatment of diabetes with casual approach. One is hypoglycemia or low blood sugar, and the other is diabetic ketoacidosis. If it was not for the hypoglycemia, we could have treated all diabetics with significant uh, 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 medications without the risk of low blood sugars. So the to avoid hypoglycemia, a diabetic has to eat at a proper time uh, and in proper quantities, uh, particularly if they're taking insulin or sulfonylureas, which is a common example would be glucotrol would be a sulfonylurea. Hypoglycemia can be prevented by taking short-acting glucose right away, like orange juice or a glucose tablet. The uh, hypoglycemia in type 1 diabetics can also be prevented by a substance that can be injected called glucagon, and that is available as a 1 milligram inhaler or an injection type product. So,
2 minutes point.
okay, can we go to the next slide? Uh, I just want to uh, finish my conversation by uh, advising you a few things. Uh, I call them the 7 steps. One is salat. They all start with an S, by the way. One is salat or prayer. Uh, the second is sleep. To be healthy, particularly with diabetes, you should at least have at least 7 hours of sleep. The third is steps, and that is exercise about 150 minutes per week, or start with 1,000 steps and go up to 10,000 steps. And the fourth point is salads. Polyunsaturated fats and salads are the main source of nutrition for the diabetics. And the things that you try to avoid, the three S's that you might want to avoid and take in moderation, is salt, sugar, and saturated fats. Uh, Generally speaking, type 2 diabetes and pre-diabetes, when you look at it from the perspective of Ramzan and fasting, is actually a blessing to have the opportunity to fast. You can organize your life, and you can restructure, and you can actually prevent the progression of the disease by losing some weight, being more organized in the way in which you eat, fast, prayer, sleep, exercise. All those things are a benefit. The only big difference between fasting in Ramzan and fasting in other situations is that you don't get water when you are fasting. So dehydration may become an issue. And as we proceed in our conversation with other specialists, we will realize that some of the medicines or uncontrolled diabetes may cause dehydration, and dehydration may lead to ketoacidosis and so forth, or electrolyte imbalance or kidney disease, etc. So if you can fast and keep your hydration proper by drinking adequate amounts of water, I think Ramzan is a blessing to the type 2 diabetic and a pre-diabetic. As regards to type 1 diabetes, I personally don't feel comfortable advising them to fast. But I think with the modern technology, I've seen athletes perform unbelievable tasks like long distance running and playing tennis, etc., and yet be a type 1 diabetic without major difficulties. Home glucose monitoring and continuous glucose monitoring has also added to the. So maybe in type 1 diabetic also can be able to fast in your future, inshallah. Thank you so much.
Thank you so much, Dr. Arstu, for an insightful presentation. Now I would like to introduce my next speaker, Dr. Yamal Al-Maki. She is board certified in endocrinology and manages a wide range of endocrinology-related conditions. She is currently practicing at Capital Endocrine Care in Bethesda, Maryland. Welcome, Dr. Yamal. Over to you.
Assalamu alaikum. Again, my name is Dr. Al-Makki, and my topic today is to discuss the recommendations for management of the diabetes for those patients who are fasting during the month of Ramadan. So whenever a diabetic is thinking of fasting, a good idea and a very important part actually is to meet with the provider, their physician, prior to starting the Ramadan. Ideally 1 to 2 months before Ramadan, because there's some things you want to go over with your doctor, and it's important. It'll be helpful when you are actually fasting. So some things you generally want to know is how to check your blood sugars. If you're already doing it, that's wonderful, but also how to check it in relation to your food, especially sahur and iftar. And try to get in the habit of eating regular meals. Try to get in a habit of doing regular exercise if possible. You know, it's a good time to discuss if any medications need to be adjusted, it should be done so at that time. Patients should become aware of the symptoms and signs of the low blood sugar or even dehydration, and gain knowledge on when to break the fast, which will be absolutely okay in a situation where there's a low blood sugar. Next slide, please. So we have a 7-point guide for checking blood sugars. This will help patients know when to check your blood sugar. So ideally, if possible, check your blood sugar before sahur and 1 to 2 hours after sahur. Try to check in the middle of the day. Try to check in the mid-afternoon. Also before iftar and perhaps 1 to 2 hours after iftar. And for those patients who are on a continuous glucose monitor, that's even better. And the continuous glucose monitor is a device that can monitor your blood sugar 24/7. It gives you updates to your phone, and it's constantly tracking your blood sugar, so it's in real time. So that's a wonderful tool. If you do get the green light too fast as a diabetic, it's a wonderful tool. I highly encourage it. And if at any point, as mentioned before, if there are any symptoms of low blood sugar, it is totally okay to break your fast. Because remember, as a diabetic, diabetes is a medical condition and it is associated with certain complications. And Allah subhanahu wa ta'ala does not want to make it difficult for us. And it's not mandatory that you must fast. So, but if you choose to, checking your blood sugar is very important. Next slide, please. When you are fasting, never skip your morning meal. The suhoor is very important. As mentioned earlier, stay adequately hydrated. Please drink plenty of water. Avoid the sugary drinks. Try to have a well-balanced meal for both suhoor and iftar. For the morning meal, try to make sure you're getting enough complex carbohydrates and proteins. And with the iftar, instead of breaking the fast with deeply fried food like samosas or French fries, please avoid that. Have the recommended food to break your food, such as the khajur or the dates, to avoid simple carbohydrates that will swing your blood sugar high and then perhaps even drop it too low. Next slide, please. So the complex carbohydrates and foods that are rich in fiber are very important because they are energy rich and they release the energy slowly. So when you have this in your suhoor meal, it will keep you from feeling hungry sooner. It'll last you longer during the morning and midday, and you won't feel as hungry. It's providing you energy. And you find this type of food in things like whole wheat food or multi-grain or millet seeds. Even the black chana, the black chickpea, is very rich in the protein and complex carbohydrates. And as mentioned before, always have a protein with your carbohydrate, walnuts or almonds, baked fish or chicken, a white egg, for example. Soy products, they all provide good sources of protein. Next, please. For those people who sort of don't know how much to take from each food group, you can refer to the plate method. The plate method roughly gives you an idea to have a quarter plate protein, a quarter plate of, your complex carbohydrates. And the other half could be, plenty of fresh fruit and vegetables, especially green vegetables. You can see there's, emphasis on water, hydration, very important as a diabetic. Next, please. Please try to avoid the simple carbohydrates like, the desserts and the white bread and the non-candies for iftar. Definitely not good ideas because these will result in spiking your blood sugar and also result in a possibility of sudden crashing and dropping of your blood sugar. Limit foods that are, deep fried, the samosas and pakoras. We all love them, but be very careful during the Ramadan. Avoid the caffeinated drinks because they can dehydrate you easily, or I should say avoid too much of caffeinated drinks. The sugary drinks, also same thing. It can spike your sugar too much. Limit the heavily oiled curries that we often find in iftar meals because a lot of times patients end up gaining weight during Ramadan rather than maintaining the weight or even losing weight because the way the foods are prepared. The solid oils are not recommended. As mentioned earlier, the polyunsaturated or monounsaturated fats are recommended. So oils like olive oil and avocado oil are much better for the cooking. Next, please. When you should know when to break your fast on either extreme if your blood sugar is too low or too high. So that's hypoglycemia or hyperglycemia. Anytime you feel symptoms like your blood sugar is dropping, such as sweating or feeling cold sweats or feeling headaches, intense hunger, getting confused, please, if possible, check your blood sugar. But if you cannot, it's okay to break your fast. That's okay. And in the event there is a low blood sugar, such as less than 70 80 or even lower, then, follow the rule of 15. That means take 15 grams of carbohydrates, which usually equals like a small carton of juice or 3 to 4 glucose tablets. And again, check your blood sugar in 15 minutes. And if it's still low, then repeat the 15 grams of the carbohydrates. This corrects the blood sugar, and it also avoids overcorrecting, where sometimes patients just consume, and then suddenly the blood sugar ends up in the 300 or 400s. So that's the rule of 15. And also, if the blood sugar is too high, it's okay to break your fast. If the blood sugar is in the 400s, for example, a lot of patients will report they feel very thirsty, they feel headaches, or they feel fatigued, or even in the case of nausea, vomiting, abdominal pain, belly pain. This could be a sign of a severe complication called diabetic ketoacidosis, and that could be very dangerous where patients end up in the hospital. So it's okay to break your fast in this instance, and please don't hesitate to check your blood sugar. In the case where the blood sugar is low and you are on a insulin pump where you're getting continuous insulin delivery, please suspend it. And follow the rule of 15. Next, please. So again, very important to meet with your physician prior to Ramadan to discuss your medication changes. But generally speaking, this class of medication, sulfonylurea that you see up here, if you're taking this, generally it's not recommended to take them, but you might be able to take them in a modified way. Next, please. So if you're taking only one tablet of the sulfonylureas, for example, glimepiride or glipizide, I would suggest just take it at dinner, at the iftar meal. If you're taking it twice daily as routine, then the morning sulfonylurea dose might need to be reduced, and the evening dose you should be able to continue. And some of the older type of this class of medication, they should just be avoided altogether. Next, please. The metformin generally doesn't increase risk of low blood sugar. So if you're taking it once a day or twice a day, you don't need to change the dose. And if you're taking it 3 times a day, you can take the smaller dose in the morning and the midday and evening dose all together in the evening. And if you're on the extended release, no need to change. Next, please. If you're on things like Januvia and Glyza, no need to change your dose. Actose, no need to change your dose. You can continue taking it. With the iftar meal would be fine. Next, please. Things like Jardiance and Farxiga. Now, these medications do increase risk of dehydration. As Dr. Arastu was saying, these are generally the newer class of medications. Not necessary to change the dose, but it would change the timing. You should change it to the iftar time because of increased risk of dehydration, because they do increase urination. The injectable medications, Trulicity, Ozempic, Wegovy, Mounjaro, Zepbound, these, because it's somewhat suppressing appetite, it can increase risk of dehydration. You might need to reduce the dose, but again, ideally before Ramadan, these changes should happen. And because they do suppress your appetite, beware of dehydration, because a lot of patients report they just can't eat or drink. Next, please. Next slide, please. Yes. So now, of course, if you have been given the green light as a type 1 diabetic or even as a type 2 diabetic and you're taking insulin, your doses are definitely going to need to be changed, which I'll discuss on the next slide, please. So I didn't talk about the continuous glucose monitor too much. The insulin pump, which is the device that delivers insulin on a continuous basis. And as mentioned earlier, there are newer types of devices called the automated insulin pumps, where the insulin is delivered and auto-adjusted if you have a continuous glucose monitor. So they are definitely helpful. But if you are still using the manual mode on an insulin pump, please do speak to your provider. Your basal rate will most likely need to be reduced in the last few hours before the fast is broken, and perhaps might need to be adjusted right after the iftar. But that you have to talk to your provider. And if you're on regular insulin, as I mentioned earlier, the NPH and regular insulin, they're older insulins. They increase risk of a low blood sugar. If possible, it's good to change over to the newer insulins that I mentioned, such as insulin glargine or insulin degludec, because they lower the risk of a low blood sugar. So NPH and regular insulin, definitely, if you cannot change it and you must take those insulins, then the doses have to be reduced. The NPH, for example, if it's given twice a day, the morning dose should be cut in half. And the iftar dose that you would take, you probably should be okay to take that. Same thing with the regular insulin, which is usually taken before the food. You want to cut the dose by half for the suhoor to avoid risk of low blood sugar in the middle of the day, and the full dose should be okay for the evening. The otherwise, if you're on the newer insulins like insulin glargine, insulin degludec, insulin detamir, those you can continue taking, but at a lower dose, 30 to 40%. And if you're taking rapid acting insulin, then your morning dose must be cut by 30 to 50%. You obviously wouldn't take a lunchtime dose because you're not taking lunch, and your iftar dose, it could be adjusted based on how you're eating. One other quick comment for iftar as a diabetic, to avoid spikes in your blood sugar, consider cutting your iftar meal into two parts. So you take your first part, and then perhaps an hour or two later, you can take the second part. And no harm in doing some light exercise after the iftar, like a light walk or some resistance training type of exercise, but avoid any strenuous exercise right before the iftar in the evening time because of risk of low blood sugar. And if you're taking the premixed insulin, like the 70-30 or the 50-50, you want to cut the morning dose in half, and the evening dose, it could be adjusted either the same dose you're taking or adjusted based on how your numbers are going. But the bottom line is you have to talk to your doctor prior to starting fasting, get the green light from them, get your medications adjusted accordingly, and check your blood sugars to avoid the major complications. Thank you so much.
Thank you so much, Dr. Yamal, for a comprehensive and educational presentation. Now I would like to introduce our last speaker, Dr. Shahid Qayyumi, who is practicing endocrinologist at Staten Island University Hospital in Staten Island, New York. He has been in clinical practice for last 30 years and also have vast experience in clinical research. Welcome, Dr. Shahid. Over to you.
Assalamu alaikum,
Walaikum
and thank you everyone for watching this webinar. We'll have the first slide, please.
Yeah.
So today we're going to talk about complications in diabetes following Dr. Yamal's talk. People who should not be fasting. So if your fasting sugar is greater than 300 milligrams per deciliter, or your hemoglobin A1C is greater than 10, then fasting is going to be dangerous. If you've recently had diabetic ketoacidosis, if you're suffering from an acute illness, if you're performing intense physical labor, if you're on chronic hemodialysis, or you suffer from dementia. So these people, it would be dangerous for them to fast. So next slide. So people who are moderate risk are those with hemoglobin A1C levels between 8 to 10. Again, people with a lot of diabetes complications such as nerve damage, blindness, heart disease, kidney disease, etc., may not be good candidates to fast if you're living alone. And we already discussed insulin and sulfonylureas. If you're very elderly, chance of getting dehydrated is worse when you're elderly, so those people should think about not fasting. Next slide, please. So people who are moderate risk are those with hemoglobin A1C levels less than 8, who are treated with diet alone or metformin or medications that don't cause low blood sugar, such as the weekly non-insulin injections, SGLT2 inhibitors, and so forth. So if you're taking those medications, the risks are low, so you may be able to fast. The safest group are the ones where the diabetes is fairly well controlled with hemoglobin A1C levels of less than 7, and they're treated with medications which do not generally cause low blood sugar, such as metformin, pioglitazone, the weekly non-insulin injections, SGLT2 inhibitors, and so forth. Next slide. Again, this is all a general health advice that you should really discuss everything with your practitioner or your doctor, because everyone's condition is different. These are generalized advice, so it may or may not pertain to you. And there are benefits of fasting during Ramadan. There can be benefits with regards to cardiovascular risk factors, except for the fact that you cannot drink fluids. So most patients with stable heart disease without too many complications can fast, except people, if you recently had a heart attack, it's not a good idea to fast. I don't think licorice is sold in the United States, but this is an international talk, so if you are eating too much real licorice, you shouldn't eat it. Certain specific cardiac conditions, such as hypertrophic cardiomyopathy, you cannot get dehydrated, so it's probably best not to fast. Also, people with intracardiac devices such as defibrillators, people taking large doses of diuretics or water pills should most likely not be fasting. Next slide, please. People who've had stroke, again, you've had a recent strokes, then fasting is not recommended. If you had a stroke a long time ago, then discuss with your healthcare provider. Again, you need to get advice as to how to manage all your multiple medications that you most likely be treating, such as blood pressure medicines and so forth. Try and stay hydrated when you can. Another category is chronic kidney disease. So chronic kidney disease is very common, especially in diabetes. People with advanced chronic kidney disease, so it's divided into stages, so 3 to 5, or dialysis is an advanced stage of kidney disease. Generally, those people should not be fasting. If you do still, if you still fast, then it needs a lot of monitoring between you and your practicing physician. Also, to avoid high potassium foods. So my personal preference with pregnancy is that Islam allows you not to fast when you're pregnant. So you should not be fasting, and that would be the safest thing to do. However, a lot of pregnant women do fast. Again, it may be safe to fast If you're taking just metformin during pregnancy, as your diabetes is most likely, or your diet controlled, as your diabetes is most likely to be well controlled, and it is unlikely that you're going to suffer from low blood sugar. So ideally, you should have pre-Ramadan counseling before you fast. Anytime you have a low blood sugar, obviously the fast needs to stop. Next slide. So for pregnant women, if you are fasting, try and maintain normal physical activity, your usual diet and exercise routine. Staying active keeps your blood sugar down. That applies to all diabetics, including pregnant ones. And they should regularly monitor their sugar, either with finger stick glucose or with a continuous glucose monitor, as sugars cannot rise too high during diabetes, as there's dangers of high sugar as well as low blood sugar. So adequate carbohydrate portioning is important. Avoid a lot of sugary foods and a lot of salty foods, excessive caffeine intake. So generally, for a diabetic woman, if you're taking insulin, I would strongly advise you not to fast. But if you do, you need to consult with your diabetes specialist as to how to adjust your insulin dosage. I think that is the last slide. Thank you very much.
Thank you so much, Dr. Shahid, for a concise and factual presentation. Now I would request Dr. Kiran Ijaz to lead the questions and answer session. Over to you, Dr. Kiran.
Okay, perfect. Thank you so much, Zamreen, and to all the speakers. This is very informative. In addition to this presentation, we have a diabetic Ramadan newsletter that we have shared, and I'll request Zamreen to put the link to the newsletter in the chat so everyone who has joined us can also access that newsletter in detail. There is one message that I would like to convey, that whatever medication details we are discussing over here is general information for each individual. You have to see your physician and cater the exact treatment options that is best suits you with your actual physician. Then now I'll open the floor for questions, and I'll request anyone who has a question to use the option at the bottom of the screen, the reaction. If you go into reactions, it'll give you an option of raise hand. When you click on that, I will be able to see that you have a question, and you can unmute yourself and ask the question from our panel. Another option is that you can write in the the chat section, or send me a direct message. With that, let's open the floor.
Assalamu alaikum, Ashraf Lakhani.
Walaikum salam. Yes, please go ahead.
I'm taking Jardine 25 milligram, and I also want to ask if is it okay to take it after Sehri or after Iftar?
Assalamu alaikum. So for the Jardians and Farxiga and that class of medication, because it increases risk of dehydration and by increasing urination, it's best to take it after iftar meal rather than suhoor.
Okay. Second part of the question is dehydration. What is can we take electrolytes during the Taraweeh time, or what is the best time before sahur? Any kind of particular electrolyte that you recommend?
I think you should be able to take it both at suhoor and at iftar time to ensure adequate hydration. But basically, getting enough free water is also important, because if you are on things like Jardians, you do lose a lot of free water too. So you can take it at either time, and that should be fine.
Okay, I'm 74 and I'll be turning 75 in about a month. So is it okay to continue? Alhamdulillah, I've been doing.
Can we please hold off to personal details and demographic sharing, because this is an open session,
Okay, I'm sorry.
and we need to discuss these with like either separately or with your physician, please. Dr. Yamal, would you like to give like a general response to it?
Can I make a suggestion?
Yes, please.
I think it is wise for him to cut the dose or even to stop it and monitor the blood sugars. He's just edging on the, and there is a higher risk for dehydration, and diabetic ketoacidosis have also been reported with this drug, unless it has been prescribed by the cardiologist. If it has been prescribed by a cardiologist, there may be a possibility of CHF, congestive heart failure. So there should be some caution to this.
Thank
Oh,
you all.
thank you. Thank you. So our next question is, can you comment again on type 1 diabetes and being allowed to fast?
The type 1 diabetes, as a rule, they don't have any insulin at all, and therefore they have to use insulin injections, and they also have to take it with breakfast, lunch, and supper, small supplemental dose of insulin. Normally, when we eat, we generate a little bit of insulin to cater to the food that we have eaten. And then there is a basal insulin that continuously protects us from diabetic ketoacidosis or slipping into diabetic ketoacidosis. So, type 1 diabetics, as a rule, I would say that because it is a very, very significant disease, fasting should not be necessary, because the Quran says that illness uh, can exempt you from fasting. Uh, but if you intend to fast, uh, and I've seen some very, very aggressive performance like long distance running and uh, uh, high level players playing with type 1 diabetes, with continuous glucose monitoring, home insulin pumps. I think it is becoming possible for them to be able to continue fasting. But I think they have to keep their hydration going, and also, particularly so, to avoid hypoglycemia. If those things become an issue, then they should stop, break the fast right away.
Great. Would any other panelist would like to contribute to the discussion?
I would just like to concur with Dr. Arast. He's absolutely right.
Perfect. Thank you. And then our next question is, give me 1 second. Yes. So the next question that we have is, can we do a blood test during fasting period?
Yes, you can do blood tests, because you can measure the blood, and you're not ingesting something, you're measuring it out of your tissue. The difference between blood glucose testing by finger stick, that's a different value than the continuous glucose monitoring, we say, like CGMS. That gives you the interstitial glucose, not the blood glucose. And the interstitial glucose may be probably lower depending on when you last ate, as opposed to the finger stick blood sugar. What the doctors do when they send you to the laboratory is draw a blood sample, and that is centrifuged, and the red blood cell mass is removed. So that's a plasma glucose. That probably is the highest compared to the three different methods of doing finger stick versus continuous glucose monitoring with the CGMS. So there are differences, but generally speaking, because of the algorithms are so that we can use any of those methodologies to monitor the blood sugars. Urine analysis and urine testing has almost been abandoned, except when you're type 1 diabetic. Then urine for ketones can be easily measured.
I think the question was whether it breaks your fast, your rosa. So it doesn't. I mean, you can also go for blood tests, for medical reasons to the laboratory if your doctor advises during Ramadan, and those things do not break the fast.
Yes, they were actually referring to finger pricking, basically.
Yes.
So
Yeah,
that is okay.
it does not break the fast.
Yes, perfect. Okay, so and the next question is any comment on barley bread? Is it better than wheat bread?
I think whole wheat, where the germ has not been removed, and barley bread probably are about the same. Otherwise, the wheat bread where the germ has been removed, there are two parts of a wheat, the germ and the rest of the carbohydrate contents. Uh, the germ has the protein in it, and so the barley, I don't think they break down they remove the germ. So, a nutrition, a nutrition expert should be a better person to ask that question.
Okay. Um, all right. And then the next question is I am a type 1 diabetic on insulin pump and CGM, which helps me control blood sugars and have been fasting for several years. So this is a person sharing basically their experience as a type 1 diabetic.
It's a remarkable achievement. Congratulations. And I think you have both the blessings as well as the success.
Great. There's another question from the audience. What are the things I should watch out for when I'm fasting? Because I have been told many times that I have a tendency of having low blood glucose sugar.
If you have been diagnosed with a low blood sugar in the past and you cannot sense it that you are low blood sugars, then I think it should be dangerous for you to fast unless you have the CGMS. But there are some conditions in which low blood sugar can occur concurrently, like kidney disease, uh, insensitivity to recognizing the symptoms of low blood sugar because you're on a beta blocker or some other medication that masks the symptoms. There is a rare condition in diabetes, which is not really that rare if you look carefully, is autonomic dysfunction. There's a neuropathy called dysautonomia or autonomic dysfunction. So those people also should avoid um, uh, the fasting because of the danger of hypoglycemia. Hypoglycemia is the limiting factor in the treatment of diabetes. Has it not been for the hypoglycemia, we can mother the diabetic with all medications that we can to get the blood sugar under control. So
I think this person does not have diabetes. Is that correct?
Yes, that's the message that didn't specify like pre-diabetic, but has an option just mentioned that she feels like she has been told that she gets hypoglycemic episodes.
we should avoid the.
Yeah. I mean, you
Sometimes
do need to be careful, or if it happens, then just break the fast.
What are the things to watch out? Like I think Dr. Yamal, you were presenting the few things like the sweating, palpitation. Would you like to comment on that, please?
Sure. I mean, for low blood sugars, feeling intense hunger, headache, cold sweats, feeling jittery or like your hands are shaking, sometimes even getting confused, your words are slurring. Those are some of the symptoms that, present with a low blood sugar. Some people just say they have headache. But that's why, if they're diabetic and fasting, it's highly recommended to follow that 7 point blood testing scale and or have a continuous glucose monitor, but also watching for the symptoms of high blood sugar where patients feel headache or fatigued, sometimes abdominal pain, belly pain, nausea, vomiting. So those are some things to watch out for. And those are going to be caught easier if they're checking their blood sugar.
Perfect, perfect. That's great. So our next question is about breastfeeding during the month of Ramadan for a new mother. How do we comment on that?
I mean, that's tricky because for breastfeeding, you have to stay very, very hydrated. So depending on how many hours the fast is in your part of the world, again, it's not mandatory for such a patient, because in order to maintain adequate breast milk supply, hydration is very important. So perhaps, they may consider not fasting that month and consider remaking them up.
I agree with that. Yes.
Perfect. The next question is, can I fast if I'm wearing a continuous monitoring system like Libre?
I think so. I think we must adapt uh, certain of our guidance for fasting based on our technology as we are evolving as humans. More and more technological advances will be made. And I think home glucose monitoring, continuous glucose monitoring, is not in contradiction. I think it's actually a benefit.
Great.
Yes,
We
yeah.
have. Mhm. Yes,
Yeah, it
Doctor.
will warn you if you have low blood sugar. So again, you need to consult with your practitioner who's managing your diabetes, depending on what medicines you're taking. So all that needs to be balanced.
Okay, perfect. Thank you so much. Great discussion, everyone. And I think we have just a minute, 2 minutes left to close. So here I would like to share the different options. Like if you are not able to fast for various reasons and you want to give donation or zakat or even homes later on, please feel free to use the email shown on the page here. It's IMI at imamiamedics.com, where you can Zelle or Vemo, but please make note of what your type of donation is, whether it can be zakat or it can be for any general donations. This information is also available on the IMI website. And inshallah, in the next, after Ramadan in Eid, after Eid, we are going to have a session about tuberculosis. So keep a watch out for a message regarding a session on tuberculosis. We will be sharing the newsletter. We have shared it in the chat over here, the newsletter about Ramadan. We'll be sharing on all the different groups and messages. So look out for that as well. And with that, I would like to thank all the honored speakers and all the participants who joined us on a Sunday morning over here in US. And happy Ramadan, everyone. Enjoy your Ramadan.
Thank you.
Allah Hafiz.
Allah Hafiz.
Thank you.